Welcome to our podcast, What No Mom Told You, where the rarely spoken truths finally get loud.
I'm Megan Nelson.
And I'm Pauline Walfish. And this is a therapist-led podcast where we talk about the things no one warned you about, the truths that are often kept quiet.
We're naming the messy parts of life: motherhood, fertility, loss, grief, and joy, and everything in between, without judgment.
Because the rarely spoken truths need to be said out loud, and because no one should feel alone.
Welcome to What No Mom Told You.
Hello, everybody, and welcome back. I'm Pauline Walfish, and I am excited today to bring you a special episode in honor of Endometriosis Awareness Month. I am here today with my standby regular co-host, Megan Nelson. Megan, I want to introduce our guests.
Yeah, hi, everybody. Today, we are here with Dr. Deniz Kocas. She is an assistant professor of psychology at Pace University in New York City. She has training in clinical health psychology, rehabilitation psychology, and neuropsychology. Her work focuses on understanding what it's like to live with both chronic and acute health conditions, including endometriosis, infertility, and neurological disorders. She's particularly interested in how stigma affects mental health behaviors, and people's experiences with healthcare. And she also develops tools to better measure and understand these experiences. So, Deniz, welcome. We're so happy to have you on here today to shed a little bit more light about endometriosis and the mental health implications of that.
Yeah, so thank you both for having me. I'm really happy to be here today and to talk about endometriosis. So yes, I can definitely tell you a little bit more about endometriosis. So this is a condition that affects women, and it happens when the tissue that's similar to the lining of the uterus is actually found outside of the uterus. It affects
Always it's outside of the uterus.
Yeah, so that tissue is migrating to outside of the uterus and attaching itself to different organs within the body. That can be in female reproductive organs like the ovaries, the uterus, the fallopian tubes, or it can spread to other organs, actually, to the bowel, the bladder, the rectum. And in rare cases, it can also go to the lungs, the kidneys, and sometimes even up to the brain in really rare cases. And it's often thought of as a gynecological disorder, but as I just mentioned, it's not limited to that part of the body. It's really a whole body disease. It's not just a gynecological condition, not just a reproductive health condition. It's really a whole body disease that just affects the whole system.
Do you think it's widely recognized as that, or?
Yeah, that's a great point. No, it's not. It's often thought of as a gynecological condition or a reproductive health condition because some individuals also have infertility who have endometriosis. Not everyone will, but some will. And so that's the misconception that it's only a gynecological disorder, that it's only a reproductive health condition.
Yeah. And that it's only a problem if you're trying to get pregnant?
Yeah. So, and it's not only a problem when you're trying to get pregnant. The other thing, and I can talk a lot about what endometriosis is, the other thing that's really important to mention is a hallmark symptom of endometriosis that not everyone will experience, but if you do experience this, that's really important to investigate further, is severe pain during the period, during the menstruation. So like I said, not everybody's going to experience that. Everyone's symptoms will be different, but really that should be explored further if severe menstrual pain is experienced.
I think so many people think that menstrual pain is normal. Like what's severe pain? Like, what does that look like?
Again, a common misconception, I think, as women, we're often told pain during your period is normal. Just get on with your day. Just push through it. Yeah, just like it's fine. We all have it. But no, really severe menstrual pain is you're not able to get out of bed. It's affecting your daily life where maybe you can't go to work. Maybe you can't go to school. Maybe you can't take care of your family. You might isolate yourself because of that pain. So, and there might be other symptoms associated with it as well. So really that's what severe menstrual pain is, when it's your daily functioning to the point that you're missing out on things and you're not able to do normal activities that you would do on a daily basis.
But so hard, right?
Yes,
In monthly patterns.
definitely. Yes.
So, if one of the early warning signs, let's say, is severe menstrual pain, are there other warning signs that, can say, maybe I should have this checked out?
Yes, definitely. So, like I said, the symptoms are going to vary. I just want to make that clear because that's
Mhm.
really important that the symptoms vary based
Uh-huh.
on the individual case. Some individuals will have severe menstrual pain, will have chronic pelvic pain that they develop, and others just won't. Some might find out when they're trying to have children and they seek help through an infertility doctor and then they realize they have endometriosis. So symptoms really vary. But in addition to that, severe menstrual pain, what can happen is individuals might have heavy periods, very heavy periods. They might have gastrointestinal symptoms and actually be misdiagnosed with conditions like inflammatory bowel syndrome. So those gastrointestinal symptoms might look like painful bowel movements or constipation, diarrhea, vomiting, bloating, and gassiness. I already mentioned infertility as one of the symptoms. And chronic fatigue is another one where individuals might experience just chronic fatigue in their daily life. So those are some of the symptoms of endometriosis.
Is painful intercourse?
Yes, yes. Thank you for mentioning that. Yeah, that's one of the symptoms as well as painful intercourse.
Yeah. Which I know some of my clients have mentioned it and like so confusing. Like why all of a sudden it's really uncomfortable or painful.
So, your work is really in looking at the mental health implications of endometriosis. What are some of the challenges that, in your research that you've noticed are common in women that experience?
Yeah, before that, Megan, if you don't mind, I just want to mention a few things about endometriosis too that like I
Sure.
just want to add to a few things. So I think I'm not sure if I said it, but it does affect 1 in 10 women. So it is quite a common disorder. That's around like 200 million women worldwide.
Wow.
So also, unfortunately, there is no cure for the condition, but there are treatments available and will be personalized every uh, for every person depending on that individual case. And it might look like lifestyle, just management, maybe changing your diet, or it might be taking medication, or it might be surgery as well. And another key component of endometriosis is that it can definitively be diagnosed only with confirmation through surgery. So that tissue
Mhm.
goes to a pathologist, and the pathologist looks into what that tissue is. And then they say, this is endometriosis. And that's the definitive diagnosis. Some people who, may not want surgery might be diagnosed as well, but that would be a suspected endometriosis and not a definitive diagnosis. But maybe those people are being managed through medication, for example, and that's fine with them.
So for some people,
Hmm.
they're told like we think you have endometriosis, but really the only way to confirm it is to like do an exploratory surgery. And so they have to decide whether they're willing to have surgery just to find out.
Yes, yes, exactly. And that's a major limitation because
Mhm.
the surgery is termed minimally invasive, but it's still invasive because it's surgery. So that's often what's very difficult is that, to get that diagnosis, women need to go through that surgery. Thankfully, there are new methods that are being developed for diagnosis, but, still surgery remains the main way to find out if what's indeed there is endometriosis.
Yeah.
Both Pauline and I lead infertility groups, different ones, but that's one of the real struggles is like deciding, am I going to go have the surgery that we're not sure if this is what's the cause of that? And it's that decision can be
It's a
really
big decision.
difficult. Yeah.
Yeah, a really,
And
really big decision.
I think a lot of people try the other things that might confirm a diagnosis, but
Mm.
those are not always accurate, right?
Yeah, they can be misleading. They might not show like imaging, like MRI imaging might not show endometriosis. So it's yeah, there are limitations to these other methods. They can be very helpful, but we need to
Yeah,
acknowledge the limitations as well.
I know sometimes people will say like they do a biopsy, an endometrial biopsy, and it shows they have endometritis.
That's right.
Mhm.
Who wants to just jump right to surgery? Like
Mhm.
you're trying all these other things, and there's like this cumulative stress of
Yes.
doing another thing, and maybe it worked,
Mhm.
and maybe I know the answer.
And Megan, you asked me about the mental health consequences, and that really brings me to that is this is something that contributes to the difficulties that some people might have related to mental health. This is a journey to diagnosis. The time to diagnosis for endometriosis patients is on average 10 years, which
Oh
is
my
a really
gosh.
long time. A lot is contributing to that, but that diagnostic delay and trying these treatments and maybe not having the answers really contribute to the mental health consequences of endometriosis, which, as Pauline mentioned, can look like stress. It can be depression, it can be anxiety, it can be body image related
Mhm.
concerns as well.
10
Um,
years of
10 years.
pain
Mhm.
and medical appointments, and I imagine you see a lot of different doctors in 10 years.
Exactly. So that's a great point because so related to endometriosis, the education really for medical professionals as well as just education and the general public is not very good.
Mhm.
We don't go around hearing about endometriosis. Only in the last few years have we started to maybe see it. And, I've been seeing it more and more, and I get excited every time, but I see it in TV shows or movies. And I'm
Mhm.
like, finally, this is how awareness happens. This is how we know.
10 years of lots of different doctors and
Yes.
trying to get a diagnosis, seeing doctors who tell you there's nothing wrong, that
Yeah.
it's normal to have painful periods, that you should cut
Yes.
out dairy and go back to work.
Yes. So because education around endometriosis, we don't have sufficient education around it among physicians, other medical professionals, mental health professionals, and the public, it's hard for individuals who have endometriosis to know what's going on. And it's hard for
Mhm.
physicians to know. So physicians, because they're not aware, certain physicians, because they're not aware, might just say to patients, and this has been reported in many studies that just documented over and over and over that, individuals go in to see a physician and they're, as we discussed at the beginning of the podcast, they're told, that these are just periods, it's normal pain that you're experiencing. And then, when people go to other doctors, they might keep hearing the same thing. And again, a lot of evidence to support this. Individuals are told it's all in your head,
Mhm.
this is you, and even to the point where either physicians or loved ones too might be saying you're just an excessive complainer, you just like are
So
whining.
dramatic.
Yes, you're trying
Yeah.
to get out of things.
It's your anxiety, right? It's like, and the
Yeah.
thing is, when you're not believed over and over again, your anxiety is going to be heightened. And
Yeah,
so it becomes like, no, I have anxiety and also I have all of this pain.
exactly. When you're dismissed for so long, of course, that has an effect on your mental well being, whatever that
Mhm.
looks like, whether it's
Mhm.
depression or anxiety or whatever it is. It has
Or
such an effect,
mistrust.
mistrust as well. So, and really, I say that, and Pauline, you were talking about this earlier, when you know that something is wrong in your body, when you feel that something is wrong, pursue that. It's something, if you're not feeling right, like get your answers.
Mm,
Because you know your body best, really.
yeah.
But these are all things that contribute to the mental health concerns that we see, along with what I already discussed was the pain. So the pain that people are experiencing if they are an individual with endometriosis who has pelvic pain or menstrual pain, that pain, might lead you to isolate yourself from your loved ones. You might not be able to pursue your hobbies, your work the way you want to, your schooling the way you want to. I mean, that just is such a huge impact on your life. So of course this is going to affect your mental health. But in addition to that, I will say that We also know that there are some genetic reasons also too for people with endometriosis having depression and anxiety. There is some genetic component to it too that we're learning more about. But, there is a bi-directional relationship, of course, too. Like, sure, there's a genetic component, but then because the quality of life is affected so much, then that can also affect our mental health.
You may not want to go into the full detail, but is it related? Is the genetic link related to inflammation? Do you know?
I'm not actually sure if it's related to the inflammation, but just my hypothesis would be yes, that inflammation would definitely have a role in that because inflammation is such a big component of endometriosis overall, something that I didn't go into earlier, but like just immune dysfunction and hormonal dysregulation is such a big component of the condition as well, which we know that those things affect, again, our whole body and our whole system.
I think this might be the first time that you use the H word, the hormone word, right? Because so many times, like people are like, "Oh, it's just your hormones," but more and more, and endometriosis is recognized as having a hormonal component as well as mood and anxiety disorders. So, is that also part of the bidirectional
Yeah,
consequences?
that's a really good question. I would hypothesize that definitely there's a connection.
Yeah.
But, we do know that endometriosis is a condition where estrogen plays a big role in endometriosis. And so, like, the reason the pain is occurring is because of the monthly fluctuations in hormonal levels, especially estrogen. And we know that, for example, in pregnancy, some individuals experience symptom relief because of shifts in hormones. So, like progesterone kicks in more during pregnancy. So, symptom relief might happen. Or, for example, during menopause, there are changes in our hormones and estrogen. So, that change in estrogen can lead to symptom relief as well. Interestingly, like, for example, hormone replacement therapy during menopause or hormonal treatments during infertility treatments can sometimes affect symptoms and might lead to worsening of symptoms. But again, these are discussions that need to be had with a physician. It's on a case-by-case basis that this would need to be addressed.
Yeah.
Thinking about the mental health, like we talk a lot about compounding factors, right? And we see a lot of new moms and people who have gone through infertility. And I can only imagine going through years of endometriosis, possibly infertility, all of the mental health implications of that, plus pregnancy, hormone shift, new parenthood, possibly perinatal mood or anxiety disorders that we call PMADs. Wow, that's a lot. How that can be layered on, and it just becomes very, very intense.
Definitely. And like I said, it affects your whole life, really. It really does.
I imagine it affects couples too. If it's affecting pelvic pain, then, any intimacy or, caregiving roles are shifted, even like what jobs and income can be impacted by this.
Yeah, definitely. So there's a lot of evidence there to support that endometriosis really affects intimate relationships, and with us seeing that it can lead to a lot of challenges in not just intimacy but the whole relationship as a whole. And unfortunately, there are also reports of relationships falling apart because of endometriosis. Just again, that the effects that it can have on someone and their pain, and a partner might not believe the pain. So, and as you mentioned, it can affect a lot of your responsibilities in the home. Not just I touched on work, I touched on school, on hobbies, but it can affect just your ability to care for your home or care for your pets or care for your spouse or your children.
Yeah. And your sense of self.
And your sense of self, of course. And it's really is something that can, really gets to the core of being a person and a human, and it can really lead to just it affects your identity, or it can affect your identity.
I was going to say I would imagine, but I don't have to imagine, right? I know I've seen it, especially when doctors or medical professionals are telling you that there's nothing wrong.
Exactly. That dismissal is just really, really awful, and it happens way too much. And I wish we didn't see it, but unfortunately, it continues to happen. And I'm hoping that there's a shift in it, but that we know
Mhm.
that change is slow. But through podcasts like this and through other initiatives, hopefully that will change going forward.
So if you're somebody who thinks like, I wonder if that's what's happening to me, like, where should you start? Like, what kind of doctor should you see? What questions should you ask?
Yeah, it's really important to see somebody that is specialized in endometriosis. So there are endometriosis specialists around, and they will be able to do the workup that's needed, the diagnostics that are needed to determine if somebody has endometriosis. Those, again, thanks to more initiatives, we know that those specialists are increasing. But an OBGYN might have some training in endometriosis, but they're not going to have all the training. They need to have had also the specialty training in
Hmm.
endometriosis. And I would also say that because surgery can be an important part of endometriosis, diagnosing endometriosis and treating endometriosis, what's really important is that individuals seek out who are trained in minimally invasive laparoscopic surgery. So, and in excision surgery, because that is the best practice, is it's the gold standard in terms of surgery to treat endometriosis.
With a surgeon who specializes in endometriosis, not
So,
just an ordinary OBGYN or.
yeah, so OBGYNs will have additional training where they'll be specialized in endometriosis, but those individuals who are specialized, those physicians specialized in endometriosis, we also want to make sure that they have a surgical training that's appropriate to treat endometriosis. And that surgical training is excision surgery, minimally invasive laparoscopic surgery, but that they're specialized in excision surgery because there are other types of surgery that can be done that will not be effective. So it's really
And
important to go to the right type of doctor.
yeah, I've had clients who have had surgery and the surgeon said like, "No, you don't have endometriosis." And then they pursued it, saw a different specialist and had like severe, and endometriosis is staged, almost like can't, have with cancer diagnosis, you can be stage 1, stage 2, but for endometriosis, it has that same categorization.
Yes, exactly. So it has from stage, I believe it's stage 1 to stage 4. I believe it's based on the number of endometrial lesions and also the depth of the lesions as well. What's important to note, though, is that the stages of endometriosis don't correlate with the severity of symptoms that
Oh.
somebody might have. So somebody might be in agonizing pain but have mild lesions. I say lesions. When I say lesions, what I mean is that tissue that migrates to other parts of the body. Those are classified as lesions. So somebody might have really terrible pain but have mild lesions, and someone might have mild discomfort but have really severe endometriosis. So that staging doesn't really correlate with the severity
Mm.
of the symptoms that people experience.
Important to know.
Yes.
We're talking about maybe the whole experience, the whole person, and getting the care that they need. Obviously, trained OBGYN and surgeon. What else is really helpful?
A whole care team that would need to be involved. So in addition to having the right physician that's taking care of you, again, depending on the individual case, you might want to have a physical therapist that's involved in just rehabilitation. You might want to have an acupuncturist involved if that is something that you feel you would benefit from. Given the mental health consequences, you might want to have a mental health professional involved. Yeah, exactly. Who can help you with coping strategies and support throughout this process. And obviously, I'm trained as a clinical psychologist, so I feel very strongly about that this also requires mental health support. Some individuals do report that they benefit from an anti-inflammatory diet. Really, that might look like no dairy, no gluten. So a nutritionist might be involved in someone's care. So again, it's really like a full approach to care with different different healthcare
Complicated.
providers.
So it is complicated. There's a lot of different things that impact getting diagnosed, getting treated, living with endometriosis. Where should people go for reliable education about endometriosis? Many of us get our education from TikTok and Instagram, but if we want like educational content that's science backed, where do people go?
Yeah. So, I mean, one resource that I always point people to is the Endometriosis Foundation of America, which is a nonprofit focused on advocacy and research and education. They have a lot of content on their website. The organization was founded by an endometriosis surgeon, Dr. Tamer Sechkin, and also Padma Lakshmi. They founded the organization together. And so they have a lot of content on their website where the focus is on endometriosis and all about endometriosis. A lot of what I've talked about, you can definitely find on there.
Great.
So that's really a key resource that I think I would look at.
And are there support groups for people with endometriosis?
There are support groups, definitely. Know through the Endometriosis Foundation, patients can be connected to a group through there because there are a lot of patients who are members of that organization and they're trusted patients who might have a group. I think what's also important to note is just for individuals that think that they might have endometriosis, I think it's really important to attend some events where they're patient-focused events. So I mentioned the Endometriosis Foundation of America. Every year they have patient-focused meeting where different professionals come. It might be physicians, mental health professionals, patients who share their stories, acupuncturists, physical therapists, you name it.
Must be so validating.
Yes. Yeah. Oh, yes. I was just there 2 weeks ago and it was really, really a wonderful event. But not only do people get information about the condition there, but you get connected to such a lovely group of other people who are going through what you're going through. And I think that is really validating in itself, not just meeting professionals who are working in this or researchers who are working in this, but meeting people who've gone through what you're going through is just like really a validating experience.
Yeah.
I will also say that the Endometriosis Foundation has an annual medical conference, and people who have endometriosis are welcome to attend the medical conference. It's very scientific. Surgeons are showing surgical videos, and sometimes, if you're somebody who has endometriosis, some of that can be triggering. So I do just want to give that trigger warning. But it can also be very informative if you're interested in the science of this condition. 2 weeks ago, when we had the conference, it was focused on an aspect of endometriosis that is rarely discussed, but it was on how endometriosis can affect nerves. And it was so many different physicians just talking about their work on how endometriosis can affect the nerves, but also like the immune system as well. They also discuss the immune system. So that's just a great opportunity for people who have or think they have endometriosis to learn more about the science behind it. And usually the Endometriosis Foundation of America puts those two events together. So if you're here for one, you can attend the other one too.
We say this a lot sometimes when you're dealing with navigating infertility, endometriosis, anything like that you have to become your own scientist and science project almost, that it's like, so I can absolutely imagine that there are patients with it that would enjoy going to that for more knowledge. Where do you hope that education, awareness, support, research is going in this field?
Where I hope it would go is that we'd be able to get some answers about endometriosis, where we would know what causes it and where we could develop non-invasive tools for the condition so that we can diagnose it in a more non-invasive way. So those things I think are extremely important. And also having a cure. We need a cure for the condition, but we're going to get that answer by knowing how it's caused. So those are a few things that I think are just really, really important so that we can hopefully in the future eliminate the suffering that so many people are experiencing. I think those are my top three. I'll leave it there.
So, we always kind of come back to it takes people a long time to get answers and a diagnosis, and 10 years is a long time, right? What would you say is that thing that people would say over and over, like, nobody told me, right? What's the
I think I mentioned it already, but I am glad to have an opportunity to highlight it again is that severe menstrual pain is not normal. Severe menstrual cramps are not normal. I think we hear that a lot. So I think that's the main thing that I would highlight. Um,
so don't just suck it up.
exactly. If you feel something is wrong with your body and you're not getting the answers that you want and you need, I know it's tiring. I know it affects your mental health, but keep listening to your body and to yourself, and pursue those answers. And don't let go of the people that are supporting you because those are the people that are really helping you get through what you're going through. So
Yeah.
seek their support and ask for their help. And I think we already talked about it, but part of the reason that we're also not diagnosing endometriosis as fast enough is, what my research is about, which is the stigma around
Mm.
menstruation and talking about menstruation. And I want everyone to be aware that there is a stigma around that. It is a real thing, as that is changing. But from a young age, implicitly we taught or explicitly we are taught, don't talk about your period, hush hush, or don't show your menstrual products when you're at work or when you're at school, when you're walking to the bathroom, like that's private. So these messages are constantly being implanted in our brains. It might also look like, until I think, again, like a few years ago in ads, we didn't see red blood. It was always
Yeah.
pad ads. We would have blue blood being put onto the pad and and I
The
think
pad with the little happy face on it.
yes. So what's wrong with blood? What's wrong with menstrual blood? There's so much stigma around that. And there's a term in the literature and the work I do, it's called menstrual etiquette. We as women and girls were taught how to navigate conversations about endometriosis. That might look like giving a warning before you talk about your period with your friends. You might say, oh, TMI, too much information, but
Mm.
I'm going to share about my period. Or we might use terms like, what's that time of the month? Not like, I'm on my period, things like this. And
Aunt
that's
Flo
all
is visiting.
flow is visiting.
Having a nickname, yeah. Mm.
So this all contributes to the stigma and to why endometriosis is diagnosed quickly enough because as much as physicians, might not be trained well enough, other medical professionals might be trained enough, as patients, we might also not want to talk about this stuff
Mhm.
because we're taught that it's important to talk about it. So one of your questions was, what do you wish to see? And I hope that we, through again, lots of advocacy and initiatives, I hope we can see us talking about menstruation more, us being comfortable with discussing anything that comes up related to menstruation. And I think that's the way that we can address stigma. It's already changing. I'm really happy to see, change, just even real blood being shown or like red liquid being shown on ads as something.
Or what there was one of the Olympic athletes just recently talked about how she did her whole performance while she had her
Yes.
period.
Yeah, exactly. So these things might seem small, but like they all make such a huge difference to
Yeah.
how we interpret our periods and our body. So I hope that we become more comfortable because it's through that we
Yeah.
also create change, and we're all responsible for that
Yeah.
too.
It just reminded me.
So maybe this is the what no mom told you, right? No mom told you, like, talk about your period.
Mm.
Yeah.
Yeah.
Yes.
This just made me think, and I know we're at the end, but I have an 8th grade boy in health class, and I said, did they talk about periods? Because he said they divided it to girls and boys. And I was like, well, do they talk about periods in the boys' side? And he's like, not really. And I was like, all right, well, that's something to advocate against.
Yeah.
I will say it is getting better. I have teenagers who
Yes.
I have boys, and they have friends who are girls. And I'm always, every time I hear it, I like giggle a little bit inside because the girls will be like, oh, I have really bad cramps. I have my period. And then they just say it in
Yes.
front of the boys. They're not hiding. They're not like sneaking their, tampon in their little pocket. Like they're just like, I have to go to the bathroom, change my tampon. I'll be right back.
Yeah.
Like
Definitely, it's changing. I completely agree, but I think we have more work to do as well. But I'm so happy so happy to see that change and people just talking about their period more.
Yeah.
So we're going in the right direction, but we need to do more for sure.
Period talk is okay.
Period talk is okay.
Yeah.
Exactly. And just one more thing I wanted to mention is Megan, you talked about educate girls versus boys. So one thing that the Endometriosis Foundation of America does is they actually go into schools and they educate. They have like an education program that can be delivered to students, and it's all about endometriosis, and
Hmm.
it's given to both boys and girls in high schools. So that's one initiative that's also taking place to address some of the stigma and the lack of education about endometriosis as a condition.
That's so
We're
cool.
getting there.
Yeah.
Yeah.
Thank you so much for joining us today. I really appreciate you being able to come and share your research and knowledge about endometriosis and clearly passion. It's I'm glad that we could bring this information to
Thank you
people.
for
So,
having me. It was lovely to talk to both of you,
So
and I hope
thank you
your listeners learn something learn something new.
for sure.
thank you so much.
Thanks for spending this time with us. If you found yourself nodding along or saying same, that's kind of the point.
We hope you leave today feeling a little less alone. This is what no mom told you. And yeah, there's more where that came from.